Good evening, everybody. Thanks so much for joining us. I'm Gea Dunnik, I'm chair of the World Psychologists organization, and I'm very honored to be your host together with Wendy this evening. First, I'd like to take this opportunity to say some about World Psychologists. There are about 600 psychologists who sent us an email and asked if they could do something for the Ukraine people. So each day, Ukraine refugees are mailing to us, and they are matched by our team to a psychologist, and it's mostly within 2 weeks. And so furthermore, we organize supervision for our psychologists and also these webinars. There are maybe people listening that want to join us. Just go to our website and write an email. We also work with other organizations, and Wendy can tell us more about that.
Yes, we set up these webinars together with PsyGlobal. PsyGlobal is an organization who try to connect Ukrainian psychologists that they can work together with a Dutch psychologist, and the connection, then they can have some own participants and also clients, and also friends of Puluki, and also Cyflix. And we select a group of Ukrainian psychologists. They also will have in September the EMDR course. And we know that there are 100 psychologists, Ukrainian psychologists in the Netherlands right now. I hope they're also looking right now this webinar, and also all psychologists from World Psychologists and all colleagues who are interested. Yeah, very nice that you are listening to this webinar. Wow. What, Gea, can you tell what? Oh yeah, maybe it's good to say that if there is questions during the webinar, please use the Q&A. It's also possible to use chat, and then we have at the end time for questions, or maybe during the presentation. And if you have comments, you can also put it on LinkedIn after the webinar, and this will be recorded. All our webinars you can see on World Psychologist website and PsyGlobal. Okay, Gea.
So tonight we have Eva Bikanic. Actually, she needs no further introduction, but for the few people who don't know her, Eva is a clinical psychologist and head of National Psychotrauma Center of UMC in Utrecht and head of the National Center of Sexual Violence. She specializes in treatment of victims of sexual abuse. And thanks, Eva, for being here. The floor is yours.
Well, thank you very much for the invitation. Just to explain to you how the presentations are selected, I will start with a general presentation on the dynamics of sexual abuse, and then about how to support parents when their child appears to be abused, when there's a disclosure, and then finally I focus on war rape. And I think if I can share the presentation with you. So when I talk about the dynamics of sexual trauma, I'm actually talking about the web of sexual abuse. So it's not about the spider, and it's not about the flea, it's about the web. And both the victim and the perpetrator are both in a way trapped in this web. And I have worked with children who have been abused for 25 years, and it's actually only recently, the final 5 years, that I've more forced myself to understand more about perpetrators and how to integrate this into my treatment for children. And I think it helps if we understand how a perpetrator thinks or feels. I think we can improve our treatments. So there's a lot of knowledge nowadays about the numbers of sexual abuse, the impact, the psychological impact, the physical impact. But we do have to realize that it's only, well, 50 years ago, only 50 years ago, that the psychologists and psychiatrists learned in their books that 1 in 1.1 million women has experienced sexual abuse within families. That's how we thought about sexual abuse 50 years ago. There's a lot of more knowledge now compared to 50 years ago, which is, I think, a very good thing, that we know so much more about the damaging effects of experiences, any kind of sexual abuse, either whether it's once or multiple times, or chronic abuse, or at young age or older age. There's always a serious risk for psychological problems afterwards. So that's good, but on the other hand, there are still some aspects related to sexual abuse that are not moving at all. For example, victim blaming, and I will come back to that later. So if we look at the numbers, there are various prevalence studies dependent on the definition. But for example, 1 in 6 boys experience some kind of sexual abuse, 1 in 4 girls. And what we still find difficult to accept, that most children are being abused by someone very close in their own family. And if we look at the studies on the identity of the perpetrator of child sexual abuse, it's mostly the father, the stepfather, the father figure. And at the same time, that type of abuse most often is not being disclosed in childhood, but sometimes later and sometimes not at all. And this funny thing is that, well, it's not funny because it's reality, but we are trying to keep this topic away from us at a distance. But the reality is that the topic sexual abuse is very close. We all know people who have been abused, and the perpetrators are not, well, monsters, but they are most often men. 7% of child sexual abuse cases is being done by a woman or a girl. But it's a man that is, well, one of just our friends or family members, and not some monsters that look weird. I remember my daughter, who's now almost 16, she always asked me, how do they look like? How do they look like? The people who do this, do they have like a different, not again. Okay, this is a test, so wait. Okay, I'm back. But no, it's just people who we know very well. But people find it difficult to accept this. And we rather have this image, the stereotype image of rape as stranger rape, which is 15% of cases is done by someone unknown. But this is the image that we get in movies and in stories. So it's important that when we talk about sexual abuse, that we present all these different types, not only the stereotype, because of the stereotype image, especially children and young people.
Thank you for mute us, because otherwise it will very loud in Well, thank you for being so flexible, Eva, but I can imagine it's very difficult for you as well to do a presentation, a webinar in such circumstances. So there was also a chat from someone from Kiev who said they have also a real alarm. So yeah, probably we have a lot of challenges to deal with, all of us. It's still noising. Yeah. So we are very happy that there are also people from Kiev, from Ukraine, listening to this webinar. So it will be recorded. So if it is difficult to continue watching, for instance, when there is alarm, but I hope Eva will continue the presentation. And I see if there is any questions.
Okay, I'm back.
You're back.
The thing is, they don't announce it because it's a test. Okay, so thank you for your patience. So we have this stereotype image, and that is the reason why children and young people many times do not disclose their own experiences, because it does not fit the stereotype image. And they think, oh, but what my brother did to me or what the neighbor did to me is not that, with rape and fighting and screaming. And so they don't tell about it, or they try to minimize it or call it, they don't call it rape, but they call it assault, and that's why they keep it silent. So there are different types of sexual abuse also online, sexting, sextortion, children who are being seduced to put their clothes off, or being threatened, or they have to pay money. And it's a serious problem in the Netherlands, at least. And we also know from studies that those who have been victimized by online sexual abuse is very similar to offline sexual abuse. So they have, the psychological impact is not very different. And actually, maybe online sexual abuse is even worse, because the book cannot be closed. All the time you're thinking, oh, are there new images? Will they find that image? And there's all these images very often go to the dark web, where people, well, you cannot just enter the dark web, but all kind of criminal stuff is going on the dark web. But it's for, especially for parents, it's very uncomfortable to have the suspicion that your child's photographs or images are being presented to other people for sexual desire reasons. Many times when I talk about sexual abuse, I see people who have children themselves, they start being nervous and they ask, oh, how should I talk with my child about sexual abuse, or how can I protect my own child? And I often then tell that in theory, every person, small or, well, young or older age, can experience abuse. I mean, everyone, it can happen to everyone, but there are some children or people who are more at risk. And to answer the questions, I don't think we can protect our children from sexual abuse either by locking them up in the closet, but that's not the right way. But I'll come back to that later. How can we protect our children from traumatic experiences? But if we look at the risk factors known from research, it's being female, a lower IQ, the use of alcohol, drugs, living in a children's home, and the most robust risk factor for sexual abuse is a prior trauma, a prior sexual abuse, a prior physical abuse, prior domestic violence. And I think it's quite shocking, but there have been a lot of studies being done on re-victimization, which means to be abused again and again and again. And we know that 50%, 50% of the children who have been sexually abused will be abused again in adolescence or in adulthood. So that is a very sad story. And it accounts for those children who have not had the chance to process their experiences. So most often they just try to forget and not to talk about it. And so there's a lot of avoidance. And if we, well, I'll come back to that later when we talk about post-traumatic stress disorder, just to explain to you why children who have been abused physically or sexually or by domestic violence, why are they at risk to be traumatized again? It doesn't, for some people, it doesn't sound logical. You think, okay, it happened once. Why should it happen? Why would it happen again? And just to give a short answer already, I think that children who grow up in unsafe families and who cannot leave the home because they are small or they are afraid and they cannot fight back, they just cooperate and try to survive and try to de-escalate, and or they freeze or they do nothing or they cooperate. They do just anything what is necessary to survive. So you'd rather be raped than die, which sounds strange, but it sounds logical from an evolutionary perspective. And it's very important that we explain to our patients and clients about survival responses. So also, I think that when children grow up in these unsafe families, they draw a conclusion, a wrong conclusion about themselves. They think there's something wrong with me. This is my fault. I did something bad. I'm worth nothing. Mom and dad don't like me. I'm not a good person. I'm not a good child. And that's the conclusion that children draw in unsafe families, because they cannot think there's something wrong with my dad or with my mom. You have two parents, and that's not what children do. So they don't stop loving their parents. They stop loving themselves. And I think that wrong conclusion early in life can follow you until the end of your life. So something that is not your fault does catch you. And I like this image. You probably know it, the three monkeys. And I think they very much resemble what sexual abuse is about. So let me bring you to the monkey on the right side. So this monkey would represent the victim. I don't like the word victim because I think if you have survived sexual abuse, you are not weak, but you're very, very strong. But that's my own perspective. So I have difficulties with the term victim, but for the sake of the presentation, it's easier. And the victim has learned not to speak. The victim has learned, if I speak up, something terrible is going to happen with me and or with the person who abused me. And so there's just a commitment that you make with yourself not to speak, never, ever. And boys make this commitment with themselves even stronger than girls. And then in the middle is the person who committed the abuse. So that would be the perpetrator. But in a way, I don't like perpetrator either, because it's a perpetrator behavior. A person is not a perpetrator. I mean, I think a person is someone's son or daughter or neighbor or colleague or father or sister, but it's not that you are a perpetrator. But again, this is my perspective. And the perpetrator does this. So he or she does not want to face his or her behavior, is this bad behavior. And on the left side, you see the monkey with the hand on the ears. And that's the rest. That's the society or the family or the system. And this monkey just doesn't want to hear the reality, this very uncomfortable reality about sexual abuse. So this is all us as well. therapists as well, psychologists as well. We know sexual abuse exists, we know, but when it comes really close, we sometimes try to resist as well. So I think the largest problem with regard to sexual abuse, it's ourselves in accepting that this is the reality. And in a way, the victim and the perpetrators have parallels as well, because they both tell themselves it didn't happen. That's what the victim does. Didn't happen. And in the end, you start believing it didn't happen. And it's just a way, a coping strategy to, well, to have a double life, to bear the secrets. And I think children who have been abused chronically, they can have a gold medal for pretending as if. They're just major act players in order to survive. But when the abuse is over, they are still very good at leading double lives, even when they are in our room, in our practice room. The perpetrator, in a way, does the same, because there's this inner feelings, inner thought, inner speech, and in a way, he or she also tries to not to think about it a lot. And then we have this monkey on the left side making all these victim blaming comments to person who disclose their sexual abuse experiences. And I've done a small study in the Netherlands asking adults who were sexually abused as a child, and I asked them, so tell me, what was the first response of your, when you disclose, what was the first response of your beloved or your friends or family? And they were sending me all these sentences, and I tried to make categories, because there were mothers, very explicit, families saying, oh, you are a disgrace. Why did you tell? The family has fallen apart because of you, because you opened up your mouth. And then there's the category of people asking why. Why were you there? Why did you do nothing? Why did you not report? Why didn't you tell? Why do you tell now? Why didn't you tell before? All these why questions, they're just killing, literally, because it's exactly the question that victims are destroying themselves with already. Self-blame. Then there are the people who, well, they always know better, and they say, oh, why did you go there? I knew he was no good to you. This would never happen to me. I would have done this, and I would have done that, and I would have kicked him, blah, blah, blah. And it's not very helpful. And then there are people saying, oh, did you still get over this? That's so long time ago. Come on, get over it. Forget about it. Go to therapy. Let's get over with it. Come on. And then there are people who don't believe it. Like, are you sure? Are you sure? Are you telling the truth? Nah, you're not telling the truth. I would have known. No, he didn't do that. This person could not have abused you. I know this person. Or you're a liar. If this was true, you would have gone to the police. Then there are people reacting like, oh, aren't you exaggerating a little bit? I mean, you haven't been raped. It's an assault. I mean, we all have experienced some negative stuff. And then there are people saying, oh, this happened to you. You're such an intelligent person. How could this have happened to you? Or, for example, oh, yeah, but there's always something with you. You always have these strange experiences happening to you. This is typically happening to you. Why don't you go to a training and for self-defense? That will be better. And there are just so many of these victim blaming sentences. And to be exact, 75% of the people who disclose will get a negative remark or a victim blaming remark. And I cannot blame victims for not opening up their mouth, because I mean, you already feel bad. You're not waiting for such a remark. And I mean, it will not surprise you, but we know very well from research what is helping people after they disclose. What is helpful is social support. Oh, really? Thank you. Thank you for sharing this with me. Thank you for your trust. I will take care of your trust. What do you want to share with me? How can I help you? This is not your fault. There's nothing wrong with you. You are not strange. You are not crazy. You are not filthy. You are not the sexual abuse. I'm here for you. It's not that difficult, but hey, it appears that it is. So we are very good at supporting others when there is a car accident or a fire or someone dies, and you say, oh, your empathy. But with regard to sexual abuse, something changes. It's a pity, because it could make a difference. Because we know about victim blaming, which is also called second rape, because victim blaming can damage even more than the rape itself. So if we look again at these monkeys, when I think about how can we proceed with developing our knowledge on sexual abuse, it's the monkey on the left side that has to learn with regard to how to respond. Because when the victim blames himself, the perpetrator blames the victim, the community blames the victim. It's not strange that guilt is, I think, the main problem as a result of sexual abuse. Feelings of guilt. And this, in my opinion, is the main source of all these psychological problems that can result after sexual abuse. So depression, harming yourself, eating problems, and so on. But guilt and blaming yourself and putting yourself as the responsible for what happened is, I think, the source of these problems. And many times perpetrators induce this guilt, especially with boys, when they have a genital response, an erection, or they ejaculate. It's an automatic response from the body as a response to stress. It has nothing to do necessarily with the desire, sexual desire, or consent. It's an automatic response of the body. But of course, the perpetrator will say, oh, don't worry, boys are supposed to like this. You see, you like this too. We're doing this together. You like this as much as I do. And so the perpetrator is making the victim how do you say that? Like 50-50%, we are in this together. And that is very smart from a strategic point of view, because the perpetrator knows, if I can make sure that the victim feels responsible for the sex and for the consequences of the disclosure, the victim will not speak up. Right? It's logical. So many times perpetrators put a lot of effort in making the victim feel responsible for what happened and the impact of the disclosure. And with regard to boys and men, if we look in the Netherlands, for example, 1 in 4 victims haven't told anybody, and women, and 1 in 3 abused men never told anyone. And so we know that this is the result of more shame and more guilt in boys, because we as a society expect boys to be strong or to like sex, or if they don't want something, they can just tell or they can act, which is not the case, because both boys and men, just as women and girls, freeze or so-called tonic immobility during sexual abuse. 70% of all victims, and independent of gender, will do nothing or cooperate.
And
so all
there is
these stereotype images that we have about fighting and screaming, that's more something from the movies. It happens, but it's definitely not the major. Most normal response is not do nothing or cooperate.
there is a question, Eva,
Mm-hmm.
and there's a question it's about is pretending it didn't happen also a risk for becoming a perpetrator themselves?
No, I don't think so. If we look at the numbers, 30 to 45% of the perpetrators have been sexually abused themselves. But being a victim, if we look at how victims become perpetrators, the experts, I'm not an expert on perpetrators, but the experts say that if it goes on from victim to perpetrator, then it's more with regard to having problems with regulating your impulses, more than what you just mentioned. So, and it's very often when parents are very often afraid that their child will become a perpetrator. But of course, we say that being into therapy is already a protective factor. But also most children that have been abused are at more risk to become a perpetrator than children who have not been abused. But most children who are abused do not become a perpetrator. It's a myth. It does work the opposite, but not from a predictor point of view. Okay, so I think this is quite clear. Stop victim blaming. And I'm telling this because we psychologists do this as well. When we, for example, in my own team, we notice that sometimes we make remarks like, I don't know, for example, the babysitter was a man, a boy, a 16-year-old boy, and he abused the children. And then a trainee would say, well, why would you take a male babysitter? And this is a form of victim blaming, because why couldn't we have male babysitters? There's nothing wrong with trusting a person. That you cannot be guilty of trusting a person. So now we have a so-called a tutor, toot. And every time when one of our team members makes a victim blaming remark, it's a toot, like, don't do this. And we try to educate each other. Yeah. So it didn't happen. So you're trying to forget, you're trying not to talk about it, you're trying to not to watch television with sex in it, you're trying to avoid people who talk about sex, etc., etc. I think some people can become like 80 years old by surviving by avoidance. And one minute. It's my battery, but not the alarm. So there are people who are just telling themselves all the times, don't say. They don't tell anyone. They don't tell themselves. They don't tell their partner. They don't tell their best friend. they have this big secret, and it's stressing. That's why I mentioned this, nothing haunts us like the things we don't say. Because all these suppressing, and giving a lot of stress. So the stress system is in a way all the time on. And in combination with this early conclusion about yourself as a child, thinking, I did wrong, it was my fault, I should have known better. There's something wrong with me. There's something very, very wrong with me. So this negative self-image. And we have here a study where abused children have been followed into the future for 30 years. And yeah, you cannot go around it. This experience of child sexual abuse does put a person at a major risk for depression, anxiety disorder, suicidal ideation, suicide attempt, alcohol dependence, drug dependence, all kind of, well, attempts in a way to suppress this everyday tension. Or if you don't feel anything at all anymore and you feel numb, emotional numb, you try to feel something by using drug, for example. And well, I think it's just very sad, you know, all these numbers about the size, the prevalence of sexual abuse, and then all these different types of sexual abuse, and then the chance of being victimized again, and then the chance of developing psychopathology. What should we do about it? And one of the things that I think is very important is that when we know that children have been abused, even after treatment, we should not stop monitoring them, because we know also when these children become older, when they grow older, let's say 5 or 10 years later, they have different, they think differently about what happened and about themselves than 10 years before. So it all the time changes. And I think it's important that we move along with them and try to explain what these changes imply. Now, PTSD is a very high risk after sexual abuse, post-traumatic stress disorder, and these are all the different symptoms. You of course know about this. And PTSD often goes along with other disorders. It's very sensitive to go along with other problems. And well, if I would say PTSD in a way is a problem with your memory. It's not a problem with the trauma, but a problem with the memory, because you do not succeed in processing it in a way that you process other events in your life. Luckily, we have very different types of trauma-focused treatments of PTSD, evidence-based. So I think that's the only good thing that we can say about in this presentation, and that yes, it can cause PTSD, but I think we can say that there's like 70% chance of getting rid of this post-traumatic stress disorder if we do it properly, which is not always easy. But we do have studies that are very encouraging, showing that PTSD with or without comorbid disorder, you can just do it. You should not say, oh, well, this person has personality disorder as well. What shall we do now? You can start either way. And also we know that the age at the start of the sexual abuse does not influence the treatment effects. Also, dissociation or the duration or the severity of sexual abuse does not explain why some people do not get rid of the post-traumatic stress disorder. Until today, we do not know the exact reason why some people just cannot get rid of the PTSD, despite you've tried everything, EMDR and imaginary exposure and everything, and still. But there are challenges.
Yes, and do you know something about the prevalence of our patients in like general psychiatric hospitals who come to for therapy? The prevalence of victims, sexual
60%.
violence? 60.
Mental health care. It does matter well whether it's the first line or the second line or the third line.
So if you have 10 clients in treatment, there should be 6 have
Yes.
experience with sexual violence
Yes.
in the past.
But
Wow,
they will
that's-
not definitely share this with you voluntarily. So we have to ask people. We have to ask people. And what I learned, and it helps me a lot, I'm not asking the patient, have you been sexually abused or have you been abused? So I'm working in a trauma center. So, okay, it's a bit different, of course, because it's not a general mental health center, but I just ask them, what kind of negative sexual experience do you have? So I don't wait for yes and no. I assume a yes. And then I ask, what kind of negative sexual experience have you had or have you experienced? Online and offline, because young people can have online sexual abuse experiences as well. But it's a good question, Wendy, because in the mental health care, we have problems with just asking about trauma experiences, in specifically sexual abuse. We have difficulties with screening for PTSD because many people are not screened properly. And then when the PTSD is diagnosed properly, we have problems with following the guidelines because we think, oh, well, let's wait. Let's first explain how the therapy works and let's do first some reading or relaxation techniques. And in fact, we know, and I will share with you some studies that we have done in the Dutch rape centers, that people are actually okay with starting immediately the trauma-focused treatment. And yeah, it's not very surprisingly, actually, if we know that these children and people have survived years of lying under the neighbor or lying under the stepfather. Come on, then they will survive 3 or 10 EMDR sessions, I think, because the worst is behind you. That's what I tell to children. I always tell the children, okay, so in your mind, you have these images and they're haunting you, right? Yes, yeah, but they cannot bite you. They cannot kick you. It's in their images. Yeah, okay, let's do it.
Eva, I have also a question. You are working in a sexual center where in a center where sexual abuse is like common. What would you ask in like a normal therapy center to get this question
Yes.
On the table?
Yes, I would say, please tell me about your negative life experiences. Everyone has negative life experiences. You, me, there's someone here. Everyone has negative life experiences. And then you can give the person, the patient or the client, control over, you can make your own choices what to share at this moment. And then you can repeat the question later on. Are there other negative life experiences that you want to share with me? So in general, we know from research that if you tell someone, please tell me everything about blah, 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 the person will respond with more and rich information than when you ask a closed question. but we do have to endure and have the patience to wait, which is sometimes difficult because the person, when you ask, tell me about your negative life experiences, oh, the person has to check, okay, negative life experiences. And then you're going into your library in your mind with the compartment, negative life experiences, and you think this, oh, nah, this. Bullying, okay, the bullying. And then he or she can make his own choice.
Okay, thanks.
Okay. So there are still some misunderstandings about trauma-focused therapy. And I think it's very nice to explain to people and patients as well that we have good experiences and we can just start. The thing is that we therapists have the tendency to start with EMDR therapy, and then after 2 or 3 sessions we think, today I will do something else. Today I will do drawing, or today I will do, I don't know, cognitive behavior therapy. So we are not so good in sticking to the plan, although we know from research that it's really better to stick to the plan. We're only humans. Something that's also challenging, and we often forget that post-traumatic stress disorder is not only in the mind, it's also very much in the body. And unfortunately, the experiences of rape or sexual abuse will put the person at a higher risk for sexual problems, pelvic floor problems. So all this tension that you're all the time carrying with you, don't tell. No one should notice. No one should notice. Just act, pretend as if you're normal. Act as if everything is normal. All this stress is just in the body. And when we do treatment, we do have to ask about, please tell me about sexuality, about your sexual, do you have problems with sexual identity? 50% of the male victims think that they are homosexual because their body responded. Many people have sexual problems. We do have to ask. Many people have problems with peeing because of the pelvic floor being very stressed. And people will never tell this from themselves. It's just too shameful. But when you say, oh, other people tell me that they have troubles with peeing, how's that with you? Oh, then it's making it a little bit easier. And then I want to share with you an experience that I did in the Corona period, the COVID period. We had developed a webinar for people who have been abused as a child. So it was a kind of self-help webinar. And so people were free to send us their questions. And then we would answer the questions in the webinar. And many different types of questions came in. For example, why me? How come I still feel guilty? Should I tell my partner? Should I tell my children? Is it normal to hate myself? Is it normal to hate my body? Will my life ever become normal? Will I do the same to my children? Why do I lubricate when I remember the abuser? How can I trust others? I know I was abused, but I have no memories. Why do I feel so lonely? Can this happen to my children as well? Etc., etc. And now what I learned is, of course, PTSD is one thing. And it's very important that we screen it properly, that we treat it properly, yes. But there are so many more aspects of sexual abuse surrounding. It has nothing to do with PTSD. It is the result of a long-term, lonely speech with yourself because you kept the secret for yourself for so long time. And the only person that you have been talking with is yourself. So it's important that we know that these these questions are essential and that we can help people with trying to find answers, that they don't do this any longer alone. So why is it important to treat PTSD? Of course, it's about quality of life, but most of all, having PTSD increases the risk of re-victimization. Having PTSD, especially the emotional numbness in the cluster avoidance. So just to explain it, you are being abused by your neighbor for years. You are pretending at home as if nothing happened. And you manage by just shutting off your feeling. Great solution, fantastic. Although when the abuse ends, you are still a champion in shutting off your senses. And that is making the person at risk, because you need your senses and you need your intuition and you need your feeling every day in the relation with yourself and in the relation with others, especially your loved ones, your partner and your children. So that is a big, big problem. And when we manage to do this, when we manage to screen PTSD, it's therefore very important that we do our utter best to get rid of that PTSD. Okay. I like this image. It's the end of part 1. I'm taking you to part 2. Is that okay? Okay. No fire alarms any longer.
And there is another question. Maybe you can, I know for sure you can do 2, 3 things at the same time.
No problem.
The question is what to do when clients overwhelmed by emotions during the therapy and not able to regulate their intense emotions.
Well, in the beginning, most people react like this. And I think it's just very important that you as a therapist go on, if you're doing EMDR therapy, just to go on and to proceed and to keep calm yourself most, because you, how do you say that? It's not strange that when you have been silent for 30 years and you are in this EMDR chair, that you are stressed, or I mean, I think that's very normal. And if you don't, if it doesn't scare you and you just go on, and the EMDR session itself will calm down if you proceed. That's my experience. But if not, if it doesn't help, you can just take a break or make the session smaller or make the targets smaller, or sometimes with children, I do like a remote control. We put the image more far away, or we have more distraction, or I put the child not in the chair but standing up or moving, and well, you sometimes I ask the child, what do you think? What could help?
I think that you also create some holding also.
Yes, or sometimes we make an agreement on a safe place, or they take something they cuddle with, or some symbol that gives them strength, or some memory that gives them strength. Like, do you remember when you went to swimming for the examination and you did? Yes, I remember. Okay, hold on, let's go on. But I think the most important thing is that you yourself as a therapist give the impression that you know that this session will end in a good way. Either way. Because the child, and even adults as well, they are looking at you as well. So you are a guide as well in the storm. Okay, so this is part 2. This is about parents, because parents, when they hear that their child has been abused, and so this is outside of the family, I think it's very normal to panic, be in shock. I have seen parents fainting, sadness, fear of the future, anger towards the perpetrator, anger towards themselves, rage, shame. What will other people think? I'm not a good parent. I haven't seen what was going on. I gave my child to the neighbor. How could I have done this? Sometimes feelings of betrayal because they were with their child day in, day out. And they were sitting at the table, going to holiday, reading books before going to sleep. And all the time, my child had this big secret for me, his mother. Whoa. So a lot of feelings are at the same time active. Alienation, denial sometimes as well, because that would be the best solution. All this just didn't happen. That would be the best. I mean, accepting the facts is more difficult. So we have different kinds of responses seen, and sometimes it happens that parents deny, like, you're a little liar, don't tell anyone, go wash your mouth, or so what, it happened to me too. Don't be such a pussy, it's all your fault, you're disgracing the family. It happens, really. And yeah, I think if you have been abused in combination with not being believed, it's, I think, even worse. So I think when we have the chance to speak with parents, it's very important to tell them, which is very difficult, how important they are. They are so important in this chances of getting, or chances of processing it in a proper way, because we know from research that parental stress is a strong predictor for PTSD in children. When parents stay very anxious, very sad, crying all day long, raging, that is a predictor for the child will have PTSD sooner or later. So keep calm and parent on is easily said, but difficult being done. Also, it's important to explain to the parents why their child did nothing. Explain about fight, flight, freeze responses, explain about survival responses, and that it's actually normal to behave like this in a threatening situation. Explain to parents why their child did not tell. Many times children think, if I tell, something terrible will happen. Mom will become sad and my dad will be angry. Well, that's just the most mild version. And they all are right, these children, in their expectations. But it's also important that we explain to the parents how the perpetrator tried to make the child feel responsible, how the perpetrator was pulling the victim into the web by, for example, how does that? Often the children are threatened. If you tell ... If you tell, I will go to jail. If you tell, you will go to jail. If you tell, mom and dad will have a divorce. If you tell, grandma will have a heart attack. If you tell, no one will believe you. If you tell, I'll kill you. And verbal pressure is the most used method to make victims silent. If you tell, blah, 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 blah. That's why it's important to ask also victims, how did you know that you were not free to speak? Ask them about it. Sometimes perpetrators use more other tricks, mindfuck tricks. Oh, This is you, I love you so much. And this is how people express their love. You, I cannot live without you. You cannot live without me. You wanted this yourself. You came to me. Hey, I didn't ask you to come. You came to me. And you keep coming back to me. So, hey, you wanted it yourself. Hey, you became wet. You wanted this yourself. You wanted this as bad as I wanted it. No one will understand when it comes out. This is our little secret. So all kind of things. And it's important for parents to understand that their child was in no way could it have been escaped from this web. Many parents blame themselves. Why didn't I see? Well, you didn't see because there were no signals. Almost 50% of the children who have been sexually abused, proven, don't show anything. So you look and you look and you look and you see nothing, no signals. And those children who do show signals, the signals are not specific for sexual abuse. It can be a child crying, a child having nightmares, a child being, well, not so talkative, but that's not a signal specific for sexual abuse, except for sexually transmitted diseases and pregnancy. That's why it's so difficult to detect sexual abuse. It's important to explain to parents how perpetrators think, feel, and act. Many people think that perpetrators know in advance that they are going to abuse the child. Some perpetrators do, but most don't. Most come, well, how would I say that? Because it's not an excuse, but some people can have a heterosexual relation and then they can come into a specific situation. For example, they have a divorce and they live alone and their daughter comes every weekend and the father feels alone and he shares everything about his life and the daughter becomes, well, almost like a partner and it's very intimate. And from intimacy, the line to sexuality can be thin, especially when there's also alcohol or when someone is maybe addicted to attention or addicted to sex or wants to earn money with it. There are different motives. So the perpetrator is afraid that the child will tell and will be believed, and therefore the perpetrator will do anything to make the child feel responsible for the sex as well as the negative consequences once disclosed. I told you this before. If you tell blah, 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 blah. And the mindfuck. There are many kind of mindfuck variations, but therefore it's very important that we as therapists say, this is not normal. You are normal. There's nothing wrong with you, but what happened to you is not normal. Very important to parents to explain, this is not your fault. It's not your fault that you trusted your dad. It's not your fault that you trusted the babysitter. You couldn't have seen what was happening. If you would have known, you would have stopped it immediately. So helpful questions to parents who just keep on feeling guilty is, could this have happened to any other parent? Or if someone believes in God, would God say that you're guilty? Would you tell your friend to feel guilty if her child was raped? Or put the focus more on the perpetrator. Who initiated the abuse? Whose plan was this? Just to make clear that the parents had no responsibility. also important to explain to parents how important they are for their child's healing, so that they have to be strong, which is difficult because um, um, how to carry all of this. Many, I can tell you, many other parents talk about parents of an abused child, such as, oh, did you hear what happened did you hear what happened with Jane? Oh, that would never happen in my house. No, my child tells me everything. I can see, I know from a distance when there's something wrong with my child. This would never happen to me. My child, we have a very open family. We talk very easily about sex and boundaries. This would never happen in my family. And it's so painful because the truth is that this can happen in any family. Actually, it can happen in my family as well. My children are 16 and 19. They are at home now, I think. It could happen to them now, or maybe it has happened before. And I talk with them about anything, and I've told them many times, if anything happens to you, here I am. I'm okay with it. But that doesn't give me any guarantee. And it's very difficult to accept this, but I think it's a beginning as a solution to get rid of the victim blaming and accept our own vulnerability. So often we say also to parents, is there anybody near that can take care of you? Do you have a best friend, or do you have a sister, a brother, a neighbor that can take care of you? Because many people say, oh, I feel sorry what happened to you. I just want to let you know that I'm here for you. Yeah, right. Today. I want you to be here today, tomorrow, and also after 2 years, because when people do a report to the police in the Netherlands, the court trial can take up to 2 years. And it's important that this person, the supportive person for the family, is there all the time, without conditions. We explain to parents about the relationship between victimization and becoming a perpetrator, that we try to diminish their anxiety, and we also tell them, you are here now, you and your child are into treatment now, so that's a total difference with many people who have never had help before. We also explain to parents that their own sexual relationship can become unrestrained. They can have sexual problems, or mothers and fathers who don't react in the same way, or fathers who stay angry and mothers who stay sad, and they just lose each other along the way, which is very sad as well. And the child knows, the child can see it, and the child will think, oh, because of me, mommy is crying all the time. And of course, what does the child do? Shut up. They're really good at shutting up about what happened to them. So we also explain to parents why their child does not want to talk about what happened, because the child sees that mommy will cry and daddy has a red face when he talks, and the child doesn't want to deregulate. You don't want your parents to become emotional, not when you're 6, but also not when you're 26. You just want your parents to stay calm and stable. And we also try to explain to parents what to expect in the upcoming years, because when the child grows older, the memory can stay the same, but the meaning of the memory can change. Because when you're 6 and your stepbrother abused you, you have your memory of what it means will change 10 years later. And sometimes when the meaning changes, memories can be loaded again or can cause other problems or new problems. Sometimes a 6-year-old has anxieties with separation anxiety, but at the age of 16 will harm himself, for example. So that's why I think it's important to be honest about what we know about the future, and be realistic about it without making parents too depressed about the future, because I think people who have been abused as a child have good chances to have a good life as well, and to monitor them. What I told you before, I think it would be good to have a 1-year follow-up, come back, as we do, for example, here in the hospital. I work in a children's hospital. It's very normal for children who have diabetes or leukemia to come back in the hospital once a year, sit with the doctor, and the doctor will ask you, okay, Johnny, tell me, so how's your medication going? Okay, and how do you talk with your parents about your illness? And what are your thoughts about the future? Do you have worries? Do you have pain? Etc. And why don't we do the same with sexual abuse? Hi, Johnny. Okay, so 3 years ago, the neighbor abused you. Neighbor's now in the jail. How do you think about what happened to you now? What kind of worries do you have? Would you like to report to the police? Would you like to see a doctor? Do you have some concerns? Is there anything that's waking you up in the night? Just checking. And if there's nothing, okay, bye, Johnny, see you next year. But if there is something, then at least we are there in time, instead of waiting for years. And problems are increasing and children are trying to hide it. And then when it explodes, there's this waiting list and we are just too late. And I think it's very normal to monitor without making people anxious.
And this is your explanations about children. Do you also think in the normal mental health, in my practice, do I also have to ask people when I treat them with trauma-related sexual violence, then I ask them 1 year later come back or to continue? Because
yes, I think we have to be honest about also with adults. You can say, oh, okay, you're now 22 and well done, your PTSD treatment, high five, we did it. And I wish you a good life. And I also want to tell you that when you grow older, or for example, when you have a relationship, or maybe when you become pregnant, or when you have a child, or when you have a child the age that you had when you were abused by your granddad, or when you become a grandmother, it is possible that your memories can change. It's not strange. It's normal.
So psychoeducation is very important.
It's very, yes.
And also about the future, what problems maybe will come up, or triggers, or that you have to all explain. Yes.
But in a calm way, without making them like, oh, no, just like you do when someone has an illness, for example, with cancer. We also say, okay, you got rid of the cancer, but we want to see you back every year. You have to take these pills, and right, it's normal. That's what we do. And in a way, you can look at chronic sexual abuse as a chronic disease, because it is in your body in a way, the long-term stress, especially when it's from childhood and from within the families. And I think we take people very seriously with this perspective. So in a way, when you have this, we used to have buses in the Netherlands, and you have a strippenkaart. And strippenkaart, you come into the bus and you get like one ride on the bus. And when the strippenkaart is full, you can buy a new strippenkaart. That's what I think we should give to people, adult people, after they finish the PTSD treatment. Say, here you are, this is a strippenkaart. If you don't use it, that's okay. If you want to use it, here you are. I think that's in line with what we know from research from the long-term effects of sexual abuse. We don't have a strippenkaart in the mental health care in the Netherlands, but we should. Okay, another thing that I think very important is to explain to adults how childhood trauma can affect their parenthood. So forget the image. I will just try to make a little story of it. If I am a little girl growing up with domestic violence and sexual abuse, and there's no way to escape, and I just have to survive. And at school, no one knows. But I'm not calm. I'm not a calm child, but I'm very like ADHD, very irritable, and the school teacher is always negative about me. Oh, Eva, she cannot sit still and she's breaking stuff and she's always making fights with the children and she's not good at school. And I already have this self-image because I learned there's something definitely wrong with me. And then the school teacher doesn't like me either. And I think as a child, you see, nobody likes me. I'm a bad child. So I start acting bad behavior in high school and a school dropout, using alcohol and drugs. And I just try not to feel. I escape from home and I'm somewhere living by myself. I meet a new, my partner, and then we have a child. So I'm 21 and I have a baby. My baby here crying. Wah, wah, wah. And this noise of the baby, this crying, just reminds me of my mother crying when my dad was beating her up, or all this effort that I do with trying to calm my baby down, and she just keeps on crying. And all I can think is, you see, I'm a bad person, I'm a bad mother, I'm not able to calm down my child. Or what also can happen, and I'm putting it black, white a bit on purpose just to make it clear, the story, when you don't feel anything and when your feeling has shut off to protect yourself, and you just don't feel anymore what your child is trying to tell you, because the child is trying to catch your attention. And if you don't feel it, the child will cry louder and louder, but at one point you just give up or try to get someone else's attention. And many times, unfortunately, these children who are neglected at home, not on purpose, but because their own parents have been traumatized as well and have not been helped with processing, there's like a hole, an affective hole. Something is missing in the home. Affection is missing. They are not seen. And every person, every child wants to be seen. So the child will try to find someone who wants to see him or her. And unfortunately, many times sexual abuse and neglect, emotional neglect, is connected to one another. And if that is the case, if the neighbor, the sexual abuse by the neighbor is related to the absence of affection and safety in the child's home, we have to address this. We have to talk with parents, not blaming them and saying, hey, you are the cause of the hole, of the affective hole. No, you're saying, oh, wait a minute. You have experienced a lot yourself. Who helped you? Well, no one did. So where are these traumatic experiences? Oh, I put them under the under the cloth. Okay. So, well, I'm over it. Oh, really? You're over it? You're not over it, but I understand what choices you had to make. And you have to try to explain how unresolved trauma, unprocessed trauma is related to parenthood and feeling sensitivity for your child's needs. And if we don't do this, of course, we can help the child with the PTSD as a result of the sexual abuse by the neighbor, but that's no use if the hole is still there. Because if the hole is not addressed with the parents, a new person will come by, maybe on a scooter. Hey, sweetie, hi there, want to come with me? I like you, you're cute. And hop, there you go on the scooter. So if we want to stop this cycle, we also have to address traumatization in parents and try to motivate them to go for trauma treatment as well. Many parents will say, no, I'm okay, just help my child. Oh yeah, well, wait a minute, there is a relation we have to address. No. If Johnny is okay, I'm okay. No. If you are okay, then Johnny is even better. What about this? Let's try one session, or let's do this parallel, or first parents and then children. So I know that there are still places in the Netherlands where children on Wednesday afternoon have one session and then the parents wait in the waiting room. And then when the session is over, they go home. And that's just, you miss a lot of information. You want to know what the parents have experienced themselves, especially with sexual abuse, because 70% of abused children have an abused parent themselves. There's a strong link. So, and also give hope, tell them what PTSD is, but also give, hey, this is good news. We can try to treat this, and you are very important, and we have to make a narrative and give words and don't avoid and stay calm. And there are a lot of things that parents can do. And don't forget, EMDR therapy can be applied successfully in parents when they suffer from flashbacks. Many parents have fantasies of what happened to their child, or flash forwards. What will happen in the future? What will happen if the perpetrator comes out of prison? And we can also help them with this.
Yes, that's also a question, Eva, because there was someone who in the chat has a story about a girl who has also sexual abuse in the past, and after years she become mother and she's doing very well. The victim was free from prison, and then she said, well, I am life sentence and he is going out of jail. So that's just very difficult to deal with, because the stress that you can see him on the street or you can meet each other. Yeah, that's really give a lot of anxious feelings.
Yes, it's, yeah. But I think if someone thinks about himself, I have lifelong. I mean, how do you say this? Do you know the books from Edith Eger? The Gift?
I don't know the books.
Well, she says she is, I think, 90 or 100 years old, and she survived Auschwitz. And she said, it's not the trauma that puts us into a prison. We do it ourselves in a way. So if you want to escape from the prison, you yourself can escape. So sometimes I give those books from Edith Eger as well to people who really think that way, because yes, I do think that the sexual trauma can lifelong be presented in different ways. That's true. But I think if you use the term lifelong for yourself as a quality of for your own life, then I would do my utter best to change this perception. Yeah.
And it's also Eva Edgar Eger is also in this chat. So if someone wants to read that book, the name is in the chat. Thanks. Yes.
Okay, thank you. Okay, so I'm going to finish this one and then go to the third one. Are you still there? Yeah?
Yes, Eva, this question about the third one, I think.
Yes.
What has not been discussed here is refugees who have experienced sexual abuse from known and unknown perpetrators. And the question, the one who has this question, she asked for, or he asked for, any advice for this. Are there similarities or differences with other cases of sexual abuse?
Well, you see, up till now, I have talked with you about non-wartime abuse. I'm now going to talk with you about wartime abuse. So shall I try to answer this question in the third presentation?
Yes.
Yes?
Exactly. Yes.
Okay. Let me see where it is. Wait a minute.
So there was one thing you said was 70% of the children have parents that also experience sexual violence?
Yes, that have been abused themselves.
Yes.
Can you see it?
Yes.
Okay.
Let's see. Yeah, try that one.
Can you see it?
No, we see it with the slices on the side, but that's no problem.
This one.
Yes, that's it. Great.
Okay. Okay. So I've changed my affiliation here to sexual assault centers because I give the treatment in the trauma center, but we also have these 16 sexual assault centers. So that means that across the Netherlands, we have 16 rape centers, and they are available 24/7. And in these rape centers, the police, the doctors, forensic doctors, nurses, and psychologists, they cooperate. And it's a so-called one-stop shop model. And we copied this from the Scandinavian countries. And I'm showing to you this because of this system, we can help any person that has been raped or assaulted within 7 days immediately by the whole team. And I know that in the rest of Europe, it's not everywhere organized this way. I know in Ukraine, it's not organized this way. So it's easy for me to speak about how we cope with acute rape because we have the system. But I'm trying to just show you and maybe inspire you how you can cooperate with different disciplines. And something else that I want to share with you, it's my parents, they are from Croatia, from ex-Yugoslavia. And I was born in the Netherlands, but they raised me with 2 languages. And when I was 21, I have worked in refugee camps for 3 years with mainly Bosnian refugees. And then I had the chance to present a Dutch documentary about ex-Yugoslavia, 7 countries. So there were 7 episodes and it's called Tranen van Tito, the Tito's Tears. And in one of the 7 was about Bosnia and Herzegovina. And I talked with Aina Jusic, and Aina is a woman, and she is, I think, 25, 26, and she was born after her mother was raped. She is 27. It's 27 years ago. And I will show to you just a part of her a TED talk. I wanted to share this with you. Let me see here.
Just for me to stand in a hall full of
Yeah,
people.
perfect.
It is a big change. Don't have my own identity complete. You
Okay.
know, I'm not sure I want to find him, but I want to punish him with my existence. I grew up in a society where the word shame was common and clearly aimed at me and my mother. I didn't understand that when I was a child, and I still don't. When my mother was 22, she survived a war rape during the aggression in Bosnia and Herzegovina. A colorful wall became a world of darkness, trauma, and pain. And just when she thought it couldn't get worse, she found out she's pregnant. She was carrying a child of a man who raped her. That child was destined to carry the pain of war from the inside. She was carrying a life to grow, to become invisible, both socially and legally. That life is my life. So, hello, my name is Aina Jusic, and I'm child born out of war-related sexual abuse. So, do you find it uncomfortable sometimes to look at me? Well, okay. I find it hard sometimes, but it didn't stop me. I don't need this. But it didn't stop me from standing here today before all of you, because I have something to tell you. So, during the war aggression in Bosnia and Herzegovina, between 30 and 50,000 of men, women, and girls were sexually assaulted. As a result of those crimes, children were born. Children who live in the age of the status quo, 30 years after the war, and still remain invisible by the society that doesn't recognize them. They're often called a hidden population because if someone had known about their existence, they would have been exposed to stigmatization and discrimination. They are still exposed to social contamination, including legal and political rejection. Precisely because of that, our mothers try to hide our father's identity very wisely, which makes it more difficult to map and gather to children born out of rape in certain country. They were never being accepted by the society just because of their drawings that contain 2 figures, a mother and a daughter, which was unacceptable. People should never be judged according to those figures, especially not by those who never existed in their lives. Many kind of research has been done in conflict and post-conflict countries about consequences of war-related sexual abuse. It is clearly determined that no country has ever established the mechanisms for the protection and rights of the children born as a result of rape. Don't forget, rape is being used as a weapon during the conflict, a weapon that creates, as they are called, children of enemy. After their birth, many children were not even accepted by their mothers because of the amount of trauma they went through during such an act. These children are considered to be a shame to the family. This population is neglected. Their birth and later on throughout their life, they encounter risks and damages that can be permanent and dangerous. This may include stigmatization and discrimination by society and legal system in which they live, physical violence and emotional abuse during adolescence, peer violence in the schools where these children are targeted as fatherless or abandoned children. This population has has reduced or given no education because they have never been entitled to a scholarship like other categories of children have. Many mothers kept their children while struggling with trauma, while struggling with trauma without any financial stability and professional psychological help. For children, this represented insecurity while growing up, poverty, and even homelessness. In some countries, the common problem of these abandoned children are in armed or criminal groups, an increased risk of radicalization and poor health. Our mothers are exposed to double stigmatization as survivors of war-related sexual abuse and as our mothers. Without support, women and girls suffer significant physical, psychological, social, and economic effects of forced motherhood. The damage and our shortcomings that our mothers face have been passed on to us, their children, who are themselves self-labeled as the children born as the consequences of rape. This intergenerational effect of conflict-related sexual violence must be urgently recognized and addressed. In general, lack of specific targeted national and international policies and laws to address our needs, risks, and harms are likely to multiply and become worse in the lives of children. The lost childhood become an insecure adulthood. A human rights become an illusion. You know, I'm not the first one nor the last one who will speak about the struggle for a rightful and dignified life. I'm proud of myself for being able to gather strength together with my mother and stepfather to bear naked in front of all of you, because in choosing this struggle, it wasn't easy. I am proud to have removed the label of invisibility from our existence because I'm not ashamed of my life. This system considers a rape to be a shame, and belonging to ethnic group shows how severe is that act on the human body and life. This is a shame of status quo where we live in today. You know, global and national communities must face the taboos about reproductive violence that lead to forced motherhood, a conception and birth of children as consequences of war. The existence of children born out of sexual violence and high-yielding consequences of pregnancy and motherhood resulting from rape must not remain euphemisms in the resolutions of the national and international political actors. You know, the practical and the constant normative and practical marginalization of children born out of sexual violence and their forced mothers in post-conflict society are a significant obstacle to sustainable and inclusive peace, reconciliation, and transitional justice. Transitional justice processes that do not recognize nor enforce the rights of the children born out of sexual violence cannot meet their goals, which include truth, and I told you the truth, reconciliation, accountability, and delivery of reparation. Denying the rights of children born out of sexual violence cannot be compared to demand for human rights to universality. I'm ready to share my experience anywhere in the world. With my voice, I will break silence and show the world how these children live. You know what? I don't want to be the part of status quo that allowed us to go through and keep going through this kind of stigmatization and discrimination. I am a woman, a daughter, and a human rights activist, a young person who believes in equal society and fights for removing systematically imposed and socially created labels. I broke free. What is your choice?
Okay. I'm back. We were here. So Aina is in the Bosnia episode. And this is not Srebrenica. This is Vukovar. But maybe you can see the white flower I have. This is the symbol for the remembrance of the Srebrenica genocide. And I wear it today for this presentation. And yeah, what Aina was saying is that systematic rape was used as an act of genocide in the former Yugoslavia, and systematic rape in these cases was used as a strategy to spread the terror and fear among the population. And moreover, it was aimed at the males who were out of reach. And so through one single act of rape, the assailant can humiliate and demoralize and thereby attack the woman's male relatives who are unable to protect her. So it's an attack against one woman, but actually an entire community or an ethnic group. And that's why it's so strong. What we know about wartime rape, just to go a little bit back into the numbers, is that it's widespread and massive in scale. For example, during World War II, 2 million women were raped. In Croatia and Bosnia-Herzegovina, between 10,000 and 60,000. In the 1994 Civil War in Rwanda, up to 500,000 women and girls survived rape. And boys and men are targeted too. And there was one study looking at all the major civil wars between 1980 and 2009. It was 86 major civil wars worldwide. And the researcher Cohen found that in 53 involved reports of widespread rape in at least 1 year of conflict. So it happens a lot. But the number of the recorded rapes are underestimated due to two factors: the underreporting of rape from victims who have survived and the lack of statistics on victims who were murdered or perished due to injuries during or after the assault. So not only is there a high frequency of rape within the war, but historical evidence also suggests that the practice of war rape is consistent and frequent across countries. It's known as the cheapest weapon known to men, and the aim is to intimidate, degrade, and terrify civilians and to destroy family networks. And it doesn't happen only like in the war, but it also occurs in shelters or camps, or when people are trying to flee or to escape, or border crossing, also called the price of passage. And wherever there is conflict, there's chaos and disruption and unregarded moments for women and children. And with depression predictability, some will always seek to exploit that. That is the reality, unfortunately. And there's one artist, and I found one of her pieces of work, and I asked her permission to share it with you today. And it's this image from Kinderalbum, and there's just so much I think so much information amid what war rape represents.
And is it also, Eva, that it can be military, but can also just civilians or just people from the same culture, or it doesn't have any structure, or then
it can be, there are different types of it. It can happen. For example, in the Bosnia War, a lot of soldiers were under the influence of alcohol. Sometimes medication now are used. Sometimes it's an order to rape people as a strategy. So sometimes like in Bosnia, for example, there were rape camps where people were raped structurally and not only once. So I think there are different, a variety of types of rape, but what the biggest difference is between, let's say, normal sexual abuse, it's not normal, but you know what I mean, and the difference with wartime rape is that with normal sexual abuse, it's not meant to be seen. It is not meant to be heard. With in wartime rape, it is meant to be seen and it's meant to be heard. That's the biggest difference. Also, the identity of the rapist is often unknown in wartime rape. There's a low accountability because you don't know who the person is. The emphasis is more on violence and power than on sex. So with war rape often occurs in the presence of different audiences. Often men are also forced to watch their wives, sisters, or daughters being raped because the rape is intended to torture men as well as the women. So, for example, it has been estimated that 90% of rape in war is gang rape, thus occurring within the presence of other soldiers. And that is, I think, the biggest difference with normal sexual abuse that is meant to kept in secret. Then there's more brutalism. Rape that occurs in war has elements of sadism, xenophobia, misogyny, and medical condition also complicates the ability to treat symptoms and wounds due to unsanitary condition, lack of supplies and medication, inappropriate medical facilities, and a refusal of women to disclose rape due to the stigma they might endure. So the impact of sexual violence goes beyond the initial shock and often affects the survivor's ability to resume a normal life. Avoidance strategies, anxiety, fear, isolation, and shame are some of the main problems. Now, if you look at PTSD, it's the highest after rape. This is the various kind of traumas you see here. And the red line is how often it occurs. Rape does not occur often, but when it occurs, there's the highest risk of developing PTSD. 50% will have PTSD after rape, which is number one high risk for PTSD. And why? Because there's fear of death, use of physical violence. So there are injuries and pain, multiple perpetrators, and literally the person comes in your body. PTSD is related to proximity. The closer the stress is, the stressor, the more risk for PTSD. And with rape, the person comes in your body, not on, but in. So how do victims of human madness, that's how I call it, become survivors? Well, the best would be, but that is the ideal situation, that there is an access to survivor-centered care and multidisciplinary services, because you cannot do this alone. You need a doctor. You need someone who can collect forensic evidence. You need someone who can report for the testimony. You need someone to monitor. You need someone to check if their mental health care is needed, etc. And the post-rape includes, well, at least in the Netherlands, one can have a sexual transmitted disease or HIV or pregnancy. It's all included when people have experienced recent rape. But the time is very important, because many times people think, oh, I feel filthy, or I want to take a shower, or I just want to forget about it and not talk about it now, or not have the examination now. But the thing is that the longer you wait, the lower the chances for medical care. And after 7 days, there is no forensic evidence any longer on the body of the perpetrator. Actually, it's already, after 3-4 days, it's already gone. And it should be collected in a proper way. And I've tried to find out how this type of care was organized before the war in Ukraine. And I know that there are various disciplines, but they don't cooperate that close together. That's the image that I had, but I might be wrong. And this is how the, for example, when someone has scratches, it's all detected. The people here, they don't have COVID package, but it's to protect that the how do you say that? You don't want the human DNA of the doctors in the forensic kit. This is how this is being done. And then, very important, when someone has experienced a rape, it is very, very normal to react with stress reactions. And also in a normal circumstances, one would also, after some weeks, the stress reaction will reduce. That is a normal response to an abnormal situation. Now, some people don't have stress reactions because they have been abused before and they are in a way numb, or there's no support, they're all by themselves and they keep in a certain hyperarousal. Now, people respond to rape in this way, but how do you respond when you are in a war situation and there is no perfect surrounding environment for you to calm down, to sleep, to wash? So that is making it even more complicated. What I do want to tell you is what we call watchful waiting. It's a World Health Organization protocol that we also use in the Netherlands, but with people who have been raped yesterday or the day before yesterday. And I think it works for war rape as well. You monitor the person and important others. You inform the person about these normal stress reactions. You are not going crazy. You will be better. It's normal that you feel this way. Everything what you feel and think right now is normal after such an experience. Listen if people want to talk. Let the person make own choices. Don't say, you have to go to the police. You have to go for a forensic exam. It is your right. You can make the choice, but don't force. Encourage the person to continue the daily routine. Many times people sleep during the day and they are awake during the night and everything is upside down. Or they start drinking because they want to tranquilize themselves, but try, daily routine. What is normal daily routine in wartime? But just to have a certain structure and encourage social sharing, give perspective. You will be okay. You are okay. There's nothing wrong with you. And if possible, provide a safe place or a safe person. The response of others is important. Social support will help recovery, definitely. And I think we should just keep on sending the message around the world, just like Angelina Jolie is saying, that there's no disgrace in being a survivor of sexual violence, but that the shame is on the aggressor. It's a rational thing, I know, but it should be said. With minors, children, and young people, stress responses differ. They are more dependent from their parents, but the children look at their parents. So they are an example how to do the trauma processing. And as parental stress predicts PTSD in children, when younger minors are victimized by rape, it's even more important for parents to stay calm and to be close. Sometimes with very young children, we do storytelling, tell narratives. As you know, with trauma, especially with war, people tend to close up, not to speak. But I very much believe in narratives, in trauma narratives, because that's how we, especially with children, we tell children stories, and we can tell them trauma stories as well. And it's never too late for a trauma story. Finally, if the risk of developing PTSD after rape is as high as 50%, how can we prevent the onset of rape-related PTSD? Well, just to show you, we have done a study in the sexual assault centers. So people who were raped immediately had EMDR therapy. So they could take it's like a randomized controlled trial. So they would have either watchful waiting or EMDR immediately. So they would just sit down, and I would not ask, oh, how are you? No, immediately say, okay, tell me about the memory of the rape until today. And people just start telling, this is what happened. Okay, when you look back, what is the image that is striking you, touching you most now, which is most giving you the most tension? People know it immediately. And the study was about 2 EMDR sessions, long EMDR sessions. Approximately, people had 6 targets and 1 flash forward, because all rape victims had the assumption that they would be raped again. And the result is that watchful waiting and EMDR both are equally effective in reducing post-traumatic stress. So you can do the watchful waiting, just monitor, stay calm. But if you want, you can do EMDR as well. You can just make a choice, and they can handle it. Even people who have been abused before as a child and had recent rape, they benefited from this type of intervention from EMDR. So no harm, that was also the result. It's safe. And I just want to share this with you to encourage you to do what is needed. And this is the final message. It's a poem from Alice Walker. I am the woman offering 2 flowers whose roots are twins, justice and hope, hope and justice. Let us begin.